Welcome back, or welcome if this is your first time listening. This podcast exists for one reason and one reason only is to help you make informed, confident decisions about plastic surgery in a space that's really crowded with marketing, trends, and noise. This show isn't hype. It's not about shock value before and afters. It's about clarity and understanding how surgery actually works and how good decisions are made. Today, we're talking about the most misunderstood procedures in aesthetic surgery, the facelift. More specifically, why pulling the skin is the least important part of a modern facelift.
Welcome to Plastic Surgery TNA. Talk and advice with Dr. Earl Stephenson, board-certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
Let's get into today's topic because understanding why matters as much as understanding what. When people picture a facelift, they really imagine tight skin, pulled back, stretched, and really unnatural results. This mental image of a facelift is really outdated. And the reason is many patients are afraid of facelift because of these perceptions. Here's the reality. Skin, and hear me well, skin doesn't age first. I didn't say it didn't age, it doesn't age first. What actually changes over time are the deeper structures of the face, things that are deep to the skin. So what are those structures? The first structure is called the superficial musculoaponeurotic system, or better known as the SMAS layer. This layer provides structural support. Here's a picture of the SMAS layer. It is the layer beneath the skin that contains muscles of the upper face, typically around the eye, and muscles of the lower face, typically of the neck. This system, again, is a support system for the skin. So that ages. You also have descent or relaxation of the fat pads to give you volume to your face. This is a picture of all the fat pads, superficial and deep, of your face that can descend down and give you an aged appearance. These structures, or the support system, almost think of a pillow where the internal aspect of the pillow, the feathers, or the fat, it's the fat itself, and the covering that contains the feathers is the pillowcase. The pillowcase gets weakened and these fat pads descend. So you have the SMAS that descends or loses structural support, and you have the fat pads that descend. So those are two structures that age before the skin. The third structure are the retaining ligaments. They become weak. So when you think about a ligament, it's something that's strong, that tethers. Think of holding a belt between your hands and stretching it. And that belt is under tension. Ligaments are under a certain amount of normal tension to keep skin and structures supported and elevated or in a particular position. When those ligaments become weakened, that often lead to loosening or weakening, sagging, or descent. So these ligaments, and let's take a look at a picture of ligaments so that you have a better concept of ligaments. The ligaments are these little white branching things that are connecting. We see the skin on the outside going from your right, the skin, these little wispy fingers that are pushing up like tree branches toward the skin from the deeper structures of the bone, which are mostly to the left. Those ligaments weaken and they allow descent of the face. So those structures are weakened as well. Also, as part of the SMAS, the neck muscle, particularly the platysma, because the platysma it starts about here in the face, and it goes down into the neck, and it's a broad structure that comes down to around your clavicle and gives you these bands like I have, as you see, an aged neck, and they go up toward the lower part of the face, and that muscle weakens and gives you aging of the neck and of the jawline. It gives you a lack of distinction or depth to a certain degree, and it's not the only component to your jawline. So that particular muscle in the neck and in the lower face certainly can age and lead to an aged appearance. Now, it doesn't mean that the skin doesn't age. If it is sun damaged, then it will have a lack of resiliency from elastin and lack of collagen, which can give the surface an aged appearance. But you don't treat the surface only. You have to treat the deeper structures. So skin is simply a wrapper. In modern facial rejuvenation, the goal is not to pull the skin tight and have it under a lot of pressure or tension. That is not the goal of a modern facelift. The goal for a modern facelift is repositioning and restoration. So let me say that again. It's repositioning and restoration, where the skin is repositioned as the deeper structures are repositioned. The skin isn't pulled without addressing the deeper structures. If you have a facelift that's performed either not adequately addressing the deeper structures or not addressing them at all, and the skin is just lifted and pulled, the result tends to be short-lived, overly tight, and more likely to require revision because you'll have wide, very conspicuous scars or healed incisions. The modern facelift focuses on lifting and supporting the deeper structures, restoring the natural contours, and preserving your identity, which is the most important part. The best compliment a patient can receive isn't you look tight. It is you look rested. It's you look refreshed. You still look like yourself. So those are the best compliments you can have, and that is produced by correctly addressing the deeper structures in addition to the skin. Okay, before we move on, let me pause for just a second for just a quick reflection or an insight. This is the part that most people don't hear in a consultation. And again, I want you to hear me. A facelift isn't about looking younger. It's about looking less tired. When patients ask how many years you will take off my face, that's the wrong question. The better question for the patient is, what version of myself do I want to see in the mirror? Not that I want to be 25 again, but what version of my current self do I want to see? Because the best outcomes happen when surgery aligns with identity, not so much with age. Again, the best results happen when surgery aligns with identity and less so with age. Two patients can be the same age and need completely different approaches to restore their identity. One may benefit from neck rejuvenation and structural lifting. while another may need eyelid surgery or skin resurfacing. So there's no one size fits all facelift. And if someone is offering you one that size fits all, that should raise a concern. So let's talk about the consult. Here's what most surgeons are actually thinking during this part of the consultation. When you're sitting across from me, and I'll speak specifically to me, I'm not just thinking about skin laxity. I'm looking at facial balance, your upper third, your middle third, your lower third. I'm looking at your neck position relative to your jawline. Do you have 3D or three-dimensional anatomy to your neck, or is this all blunted full because the deeper structures have settled or there's an increase in fat? So that's what I'm thinking. I also do look at the skin quality as well as the structural descent of the supporting tissue. I look at how your face moves when you talk and you smile. I'm also thinking kind of long term, how this result will age over the next 10 or 15 years. A well done facelift shouldn't announce itself after 2 years. It should look appropriate a decade down the road. That's where restraint becomes just as important as technique, knowing what to do or what not to do. Again, I'm going to share a little pearl here in my practice at ESJ Aesthetics. More of our clients or patients are coming in educated, they're thoughtful, and they're focused on natural outcomes. And so am I. So we are typically in alignment. What I try to do is I spend a lot of time discussing what I call neck first procedures and strategies. We also use eyelids as a gateway procedure. Some people have a little bit of unrested eyes, extra skin, tear trough, weakened fat. So we try to address that as a gateway procedure to rejuvenate the upper face. And we stage some of our facial rejuvenation because not everyone needs everything at the same time or at once. So we try to be thoughtful. I try to be thoughtful in my approach to my clients. And sometimes that approach includes surgery's not the best plan yet. So honesty really matters here at ESJ Aesthetics, and it matters to me. This protects our clients because it leads to better results when the timing is right. So let's go back and summarize a bit. The modern facelift is less about the skin and more about the deeper structures. Again, let's bring a picture. A picture's worth 1,000 words. When you don't focus on the deeper structures and you focus on the skin and you pull tightly on the skin, in my opinion, this equates to a skin only or a mini facelift. You get an overly tight appearance. You get results that are not lasting. You can have tension or pressure on the scars or healed surgical incisions and cause them to be widened and produce an unaesthetic result. So you need to focus on the deeper structures. When you focus on the deeper structures, such as the SMAS, that's the superficial Musculoaponeurotic System, then you're starting to address restoring the natural contours and volumes of the face. Sometimes adjunctive procedures are needed or additional procedures are needed for volume, such as fat grafting. But addressing the deeper structures such as the SMAS is an important concept in the modern facelift. So you can address the SMAS in a couple of ways. And you may have heard these buzzwords. You can plicate the SMAS. And that's simply, and I'm going to use this folded tissue. I got a tissue right here. I'm going to try to get it if I can. So you have a tissue and you take the tissue and you've got this tissue and this is the SMAS. It's loose, it's redundant. So what you do is you fold it on itself and you stitch that folded seam together. It's like hemming a pair of pants or hemming a skirt. You fold it and you put it upon itself, and that lifts and effectively shortens that loose, lax SMAS. So you can do a plication, and that's usually done with stitches. You can imbricate the SMAS, and what that means, you take the loose SMAS and instead of folding it on itself to make it shorter, you actually take the loose SMAS and you cut it, and you cut a part out and you take the two edges and place them one over another. That is an imbrication. In my opinion, I think an imbrication is falling out of favor versus application. I think surgeons are more often plicating than imbricating. So that's one or two ways to address just the laxity of the SMAS, the looseness of it in and of itself. That procedure does have some indication in certain types of patient, and this is why consultation is so important. The next way you can address the supporting structures is what we're hearing today. The buzzword is the deep plane facelift. And what is that? That's going beneath the SMAS in a loose plane, what we call a glide plane, beneath that superficial musculoaponeurotic system, and releasing the ligaments that tend to tether. When you do application, you can fold it on itself, but it can only move so far because those ligaments are still intact. It won't let you move or plicate or stitch the face over itself, way back here. It will only go so far because those ligaments are still intact. In a deep plane facelift, we go beneath that superficial musculoaponeurotic system and we cut the ligaments very carefully as not to damage the facial nerve. And the facial nerve is much like my hand. It gives you movement of your brow, gives you of your nasolabial fold and cheek, movement of the lower lip, and then movement into the neck. So we do that very carefully and skillfully, not to damage those structures that are deeper to the superficial musculoaponeurotic system. When we cut those ligaments, and now we're able to get greater lift, greater restoration. So a client that comes in that has significant descent of their fat pass, descent of that SMAS layer, and we really need a nice elevating restoration, considering a deep plane approach is probably appropriate. It's probably an appropriate procedure. When we do that deep plane, as you can see here, there are layers to the side of the face. There's the skin, there's the SMAS, There's the space beneath the SMAS, and then there are the deep structures of the face, such as the masseter muscle, which helps you chew, the parotid gland that gives you saliva. We keep the skin attached to the SMAS, when we go and perform a deep plane. So we don't detach the skin to here and then go underneath the SMAS and attach it to here. We go by the ear. We get under the skin for a certain distance, usually about to here. And then we enter beneath the SMAS and operate below the SMAS, keeping this amount of skin and muscle or SMAS connected. That gives us greater restoration. In my opinion, if you loosen the skin over the SMAS and then go beneath the SMAS, you can kind of decrease the vascularity or circulation to the face. The skin looks a little different to me, as opposed when it's kept as a sandwich. It just seems to be, and this is just what we call anecdotal or observational, it seems to look healthier. And that composite of tissue, skin, fat, SMAS, just gives a really refined restoration, my opinion only. So we try to keep that as a composite. So we go beneath the SMAS, we release the ligaments, we're able to get and follow the natural, what we call vector of anti-aging. Aging is a descent kind of in, down, and toward the central face. We try to elevate back and away. With that, the skin comes really easily back and a lot of times over the ear, and it's not pulled. We're just repositioning the muscle. And the excess skin naturally comes with it. And we're just able to really easily remove that excess skin. And those skin edges just lay down together. They're not being pulled. They're not being stitched tight. They just lay opposed to one another. And that lack of tension at the skin level produces the finest or the most pristine scars. So, addressing the supporting structures is addressing the SMAS, either right at the level of the SMAS, and I'm going to take this down because I want to highlight the SMAS for you because that may be a bit confusing. I've outlined the SMAS in pink. It's this muscle above in the upper face, the muscle of the lower face, and this kind of leather connection, the aponeurosis. We can operate right at that level and just hem together the redundancy, or we can get beneath the level of that system, disconnect the supporting ligaments to allow us for more rejuvenation, more lift, more restoration. And faces that need more restoration to be identity appropriate, not so much reversing the clock, taking you from 60 to 25. It allows us to do that. So, with that being said, let's wrap this up. I hope you've enjoyed this podcast, our new one for 2026. I can't believe it. So again, here are the takeaways. Surgery changes form, but understanding changes outcomes. Your understanding of what we're trying to accomplish and how we accomplish it changes the outcome in your mind and expectations. The modern facelift, as I said 100 times in this podcast, isn't about pulling the skin. That's not what it's about. It's about restoring structure, balance, and most importantly, confidence without erasing who you are. So remember those words. Again, it's about restoring structure, balance, and confidence. And here at ESJ Aesthetics, we're all about restoring confidence. So if this episode helped clarify things, share it with someone who's been thinking about facial rejuvenation but feels a bit overwhelmed because it's all over the place in social media. If you do get a chance to get in front of a plastic surgeon such as myself, where you have a formal consultation, ask good questions. Seek thoughtful answers from your plastic surgeon. And remember, the right surgery starts with the right conversation. So, on that note, I'll see you next time on Plastic Surgery TNA. I'm Dr. Earl Stephenson Jr. Come visit me at ESJ Aesthetics. We'll see you next time.